Assalamualaikum. This is part 2 for quality management in medical lab. So in this part, we'll have a look on the tools for quality management. I mean, what are the things that need to be done and can be done in order to perform the quality management in the medical lab. So there are a lot of tools available, but I listed here the 3 most common tools. First is quality control, or also known as internal quality control. Second, external quality control or proficiency testing. And third, calibration. So let's have a look on the internal quality control. The objective of internal quality control is to identify errors before they impact the real test. I mean, we perform this before we do the real test on patient specimen, which is commonly done in early morning before the first batch of sample arrive. Among the things that we are looking for in quality control is measurement range. We need to make sure that the procedure, the equipment is producing result that it should be. I mean, for example, we have 3 here. Normal, low and high quality control. If we proceed with the high quality control, the machine need to produce the same range, need to be high also, so that we know that the machine, the analyzers or the procedure is appropriate to be performed on that day. And second, to test on the product stability. Of course, in analyzers, in procedures, we are dealing with a lot of reagents. They have their expiry date, they have their limitation, exposure to the environment, exposure to the temperature might affect their stability. So we can perform quality control in order to check the product stability. Internal quality control look at the accuracy and precision testing. We will look again this in the next slide. This the process where we can accept or reject the QC result using statistical technique. If we accept the result of the QC for that day, we can proceed with the patient samples. If we need to reject, there are troubleshootings or maintenance that need to be performed before we test it again, and eventually do the testing on the real patients. Usually, quality control is being done every day or based on the manufacturer's requirements. Second, we have proficiency testing. This is almost similar to internal quality control, but we are doing something that is by analyzing control that being sent by authorized bodies. They mean as the third party, not from the lab, from different organization. And for calibration, most of the time is provided by the manufacturers, and they also have their own manufacturer's requirement, or at least 6 months. We need to perform the calibration to check the machine detection system. Internal quality control, when we perform them, we need to refer to the statistical technique. This will establish performance limits for analytical accuracy and precision testing protocols. Here is the simple explanation on what is accuracy and what is precision. accuracy is the ability of the method or protocols to produce the true value. I mean the closeness of the procedure to the true value of the things that we are testing. For example, is the patient blood, glucose level should be 5 when we do the testing. It need to produce the same result, 5 or maybe 4.8. They need to be close to the true value. As for precision is the ability of the protocols to reproduce the same result. I mean, if we perform the first time, giving the result 10, the second time it need to be able to give the same quality of result. But the problem with precise, even though they can reproduce the same result, but doesn't mean that they are good, because we are looking at something that is giving the true value. So proper, the doctor can use the result for proper treatment for the patient. So what we are looking for in a lab result is to have the accurate and precise. Important for them to be accurate and also precise. By doing statistical technique for the QC, you can show if a relationship exists between data. Every time we perform the QC, we are targeting the mean value. So I will explain on these two deeper in the next slide. This permits assessment of a method performs and detection of trends. Eventually, this will be used whether to accept or to reject the QC results. We are not talking about the patient result, we are talking about the QC result. That means the thing that need to be done before we can do the real testing. So Westgard rules on LJ chart. This is the chart that being used in the medical lab to evaluate the precision and accuracy of an analyzer or a procedure. And this is where we refer when we want to accept or reject the value. Let's say, for example, this is on days QC that we perform every day for cholesterol, control 1. So this is the mean. So this is what we are looking for. Every time we expect the machine, the analyzers to give the value as close as possible to the mean. So on the first day, we perform the quality control. It gives a very good value, exactly at the center. So we accept. That means the machine or the analyzers or the procedure is good to go for that day. So on that day, the quality control is in. We can accept that the analyzer is good to go. So we can proceed with patient samples. The next day, somehow, when we perform, the result of the QC is far from the expected value, the mean. So this is the 1 standard deviation, 2 standard deviation, and 3S or 3 standard deviation. For Westgard rules, if the value of the QC is more than 3S, we need to reject the value. We need to reject the QC for that time. So once we reject, we need to do troubleshooting. We need to look and check, investigate what's wrong with the analyzer, what's wrong with the procedure that resulted in giving a value that is very far from the true value. That means it is not accurate. This is called a random error. For random error to happen, most of the time probably because of the environmental factors such as problem with the electricity or the temperature, or even one of the reagent being used is already expired. As for tomorrow, after we've done the troubleshooting, after we settle the problem, what's going on with the analyzers, we have solved the issues. The next day, they are giving a very good result, very close to the mean. So we accept. For that day, the analyzers is good to go. Then we can proceed with patient samples. The next day, this is one standard deviation. The result is out of range for the 1SD, but not more than 2SD, 2S. So we still accept for the first day. But we treat this as a precautions or warning. The day after, they are giving the same pattern. This is what we call pattern. They are not close to the true value, but not that far, not as bad as this one. So again, we might feel there might be something wrong, but the machine analyzes performance still can be accepted for that day. For the third day, they are still giving the same result, still more than 1S. And as the fourth day, they are still giving the same pattern of result, all accumulated here. So on the fourth day of starting from here, 1, 2, 3, 4, we need to reject the QC. That means the analyzers cannot be used for that day until the problem is solved, because this shows that the analyzers or the procedure is having a systematic error. Maybe because of the one of the equipment parts is already need to be replaced. So until then we solve the problem, we cannot use the analyzer. Okay, second, we have the proficiency testing or external QC. Here we have from Australasia, RCPA, RICAS from the UK, and ICAS from US. These are external bodies that provide the service of proficiency testing. These are the third party. Proficiency testing is to ensure the lab tests are accurate by harmonizing the result among peers or among the other laboratories. To evaluate method performance, same set of samples will be given to a few labs. That means one of these bodies, organization, will give the same set of sample. That means the same sample to a few labs, which they need to analyze and then return to be compared their result between them. How is proficiency testing being performed? First, by the organization send us the blind specimen. I mean, they will give us a few samples which is identical to patient samples, but we will not know the value. Blind sample, we do not know whether they are a normal sample or pathological sample, whether they are high, will be giving high, normal or low value. After that, we do the analysis, then send the report back to them so they can evaluate whether we are giving the true value of the result. I mean, before they send the specimen to us, they already know the value of that result. So now they want to look whether we have the ability to reproduce the same value, and also they will compare our result with other labs. So if we able to give, it's like a test whether you can perform and give back the answer. If our analyzers able to give the true value of the specimens, the organization will recognize us by giving the labs a certificate of participation. So by having this certificate, this will be used as a proof that the lab is able to produce quality results, because we able to reproduce the result that expected by the testing bodies. Alright guys, thank you very much. Here is the required reading, so you need to look on these two things as an additional thank you very much. Assalamualaikum.